Hello everyone. Today is an interesting day here at the Chiropractic Company because we're going to come and talk to you about sciatic pain. This is one of the most common things that a chiropractor can work with, and today we're going to get you some exercises to help those out. I'm Dr. Alan Van Scoyk, and once again I'm joined by Dr. Botros, and we are at the Chiropractic Company in Glendale. We get asked a lot of different questions on different ways that we can help out at home, different things that patients can do on their own to help manage some of the issues that are really common for our office. And so today, Dr. Botros and I are going to go through two of our favorite exercises each on how to better manage sciatic pain at home. Now, sciatic pain is really caused by an irritation of the sciatic nerve. And so we look at a couple different tissues that are most commonly designed to irritate that nerve. When we look at sciatic pain, we look at a lot of muscle problems that cause tension to that nerve. And we also look at a lot of disc issues that can irritate that nerve. Now there's plenty others, but these are two of the very most common ones that we see in our practice. So Dr. Botros and I today are going to go through some stretches, like I said, to help out with those. Not only that, you're going to get a bonus. Dr. Botros is going to give you an idea on how to affect the nerve directly as well. So with that being said, Dr. Botros, show us some exercises that we can do at home.
Awesome. Thank you so much. So one of the first things that I'm going to show you here is to help with your sciatic nerve, especially if it's being caused by pressure from the disc. So we've heard of the, disc herniations and pressure on the disc, putting pressure on these nerves that create the sciatic nerve. So what you can do is you can start off by laying on your stomach, whether on your bed or on the floor if that's comfortable, and you're going to put your hands in front of your shoulders like this, and you're going to slowly bring your back in an arched up position like that. Okay? Now the more advanced level, if that feels okay, is you can start to push a little bit more and a little bit more, and you can get all the way up like that into a cobra position. For those of you who do yoga, that's officially what it's called. And the reason this works so exceptionally well is because the disc, when it bulges, it kind of almost like gets a little bit of a bump pushing on the outside of the disc that directly it starts to affect the nerve, the sciatic nerve and the nerves around that area. And so when we do that extension stretch and we hold it for about 10 seconds, then what happens is we push that bulge back more on the inside of that disc, so it relieves the pressure off the sciatic nerve, helping relieve sciatica. Okay, so that's the first thing. I would recommend starting off, again, always listen to your body and make sure there's no pain or anything excruciating when you do this. And you want to start off by holding it for 10 seconds and doing that for about 3 times in a day. Okay, the second thing I would recommend is something called nerve flossing. Now, nerve flossing is a very interesting way to start literally flossing the nerve through the canals in which they exit from, and break up any potential adhesions and irritation on that area. And you can do that for virtually every nerve that runs to the extremities. And since today we're focusing on the sciatic nerve, I'm going to show you the nerve floss here for the sciatica. So what you're going to want to do is you're going to want to sit down like this, and you want to make sure that your posture is upright. So you want to avoid the slouched position or being too exaggerated this way. Just have a good, nice upright posture, and you're going to slowly straighten out the leg where you have that sciatic pain all the way up like that. Focus on pointing your toes up and down. Okay? Now as you do this, you're going to be actually providing motion of that sciatic nerve through the canal in which it runs, and that really helps relieve some of the pain and tension. And so you keep your knees straight, and now as I'm pointing my toes up, I'm going to look up, and then as I point my toes down, I'm going to look down. And you want to do this in a nice graceful motion, bringing proper motion into that nerve and thus helping alleviate the sciatica as well. And this one you can do virtually anytime, anywhere. And so as long as there's no pain and nothing that feels, ooh, this is a little bit shocking, then you can do this ideally 3 times a day and doing it about 10 times each time. So morning, afternoon, and evening would be a really great way to start to calm down and manage that sciatic pain. So those are the 2 stretches that I have here. Dr. Van Scoyk is going to go more into some of the muscular stretches that will help with your sciatica.
Thank you, Dr. Botros. So In my practice, you'll hear me give lots of different tips on different exercises, and so I'm going to give you two of my favorite. First one of the big muscles that causes irritation of sciatic nerve is your piriformis and glute. And so we're going to give an exercise that'll help out with this. Many patients know of a figure 4 exercise, and it's very effective in helping out with some of these issues and pains. So let's say I have pain going down my right leg. What I'm going to do is I'm going to take my right leg and cross it over my left. If I have pain in my left side, I'm going to cross left over right. And as I do that, I'm going to lay backwards. In doing so, we're going to start to create some pressure into the muscles and tension in through here. So we're going to look on addressing, once again, for left leg pain in through here. To do the exercise, you're going to pull up and stretch in this direction. And as you stretch, that's going to help, once again, tension out and get this muscle to relax over time as you tension it out. Once again, holding it 10, 15, 20 seconds. Now, for a lot of my patients who are in a lot of pain, doing this can be very difficult. So getting crossed over, laying on your back might be good, but then you can take a towel and use that towel to help pull that leg up into a better position. To do an advanced portion of this stretch, what you want to do is you want to take your hand and put it on one on your knee and one on your ankle, and you're going to look to rotate. As you rotate, being up in the air, same thing. You're going to open up some of that muscle space and allow for that piriformis and glute to stretch. You're bringing it up, rotating it over. Just as I'm doing that, and I don't have sciatic pain, I can feel that muscle quite a bit tensioning up and through there. So you'll know it right away. And especially if you have that pain, it's going to feel really good to get that to relax. My other exercise that I give a lot of times is kind of a combination of the nerve floss and that exercise that I just did there. And it's also very basic. Once again, laying on your back, I have patients bring their knee up towards their chest. Essentially, you're doing a couple different things. You're stretching out some of the space in through your low back, which helps the disc and the muscle, but also, like Dr. Botros said, partially that nerve. So we're going to bring it up and we're going to hold it 10, 15, 20 seconds and then bring it down. This one we're going to do on both sides. We're not going to do it just unilaterally. We're going to try to make both sides function better. So we're going to bring it, hold it up 10, 15, 20 seconds, and then let it down. As the pain starts to resolve and as you feel more flexible and more fluid, then we're going to do both legs where we're going to bring them both up, bring them up, pull them towards your chest, hold it, same thing, 10, 15, 20 seconds, and then let it relax and do that again. We're going to repeat these several times to help get some of the better blood flow through there as we're stretching out that tissue. All of these exercises individually are good, but once again, when you start to combine them, you're going to be hitting different groups that can lead to sciatic pain. Now, if you're confused about what type of sciatic pain you have, then it's good to get examined by a specialist who can say, here's where your pain is coming from. Once again, who can you come to? Chiropractors here at the Chiropractic Company. We're all very well trained in being able to assess what tissues are healthy, which ones aren't healthy, and which ones need help through some of these exercises at home. So, if you have any questions about that, please let us know. Once again, Dr. Botros and I will be happy to go through those with you. I also, as I'm closing here, wanted to thank all the people who commented on our last video and shared our last video. We really appreciate you doing that. Once again, you're more than welcome to do that today. And as far as our contest is concerned, we'll be touching the person that, reaching out and touching that person and getting them the supplements for the winner for last week. We'll be looking to do more giveaways here in the future. So once again, I'm Dr. Alan Van Scoyk with Dr. Botros, and we appreciate you watching these. If you have any other questions or concerns, like I said, let us know. Either contact us through our website, chiropracticcompany.com, through our emails personally, or through our phone number, 414-332-0859, and we'll talk to you soon. Join us next week for our next Chiropractic Company Facebook Friday video as well. See you then.